It is warmer weather, of course, happening right now, and that means you are out and about, you're hiking, you're camping. I don't know if you've been up in the mountains yet, but we have something called ticks. And Dr. Petersen is here from Holtorf Medical Group to warn you about something that comes along with ticks. It is called Lyme disease. How common is that?
It's shockingly more common in Utah than I ever imagined. When I came here, I did not anticipate treating this a lot. I did my residency in Pennsylvania, but I've been blown away by how common it is.
Okay, you need to explain to me, what is Lyme disease?
Okay, Lyme disease is a bacterial infection. There's a bacteria called Borrelia, and it was discovered in Lyme, Connecticut, which is where it gets its name from. There are well over 30 different kinds of Lyme bacteria. Borrelia burgdorferi is the one that Lyme is named after. Here in Utah, we actually have a different strain. Now, people travel a lot, and particularly in Utah with international missions and missions to the eastern part of the country, we bring stuff back all the time. I see lots and lots of return missionaries with this. But the deer tick, we're like, well, we don't have the deer tick, so epidemiologists say we don't have that problem here. Well, we have the Ixodes pacificus here, which is an even smaller tick. It's about the size of a sesame seed, and that's what transmits this disease here.
Wow.
That tiny?
Yeah.
So where do they usually bite you, and how do you know you have Lyme disease after?
Right. They bite wherever they can get to your skin. So usually it's around on your legs. You know, if they can get up under your socks, get up under your pants,
they'll do it.
That's where they'll bite.
And you don't feel the bite though, do you?
No, you won't feel the bite. You may notice the tick afterwards swollen on you. You may never notice the tick because it drank as much blood as it wanted, it dropped off, and it's gone. So acute Lyme disease, you'll have symptoms of a headache, achiness, a rash, swollen lymph nodes around that area, but that's all the symptoms you'll have.
Not a ring around it or anything that would be a telltale sign that that's what that
Oftentimes
is?
there is that rash. It's called a bullseye rash, but it's not even necessarily at the place of the bite. That's most common, but some people never get that rash.
Do you have to get treated, or can you treat yourself? What happens next?
You should get treated. If you're treated within 72 hours of a tick bite, you have a pretty good chance of not developing chronic Lyme disease. However, if you're not treated in that period of time, you have a very high likelihood of developing chronic Lyme disease, which is a significant problem.
So when you say treatment, what are some of the things that you class as treatment? Is it bleeding? You know how they bleed, you know, back in the old days.
No, if you're treated within the first 72 hours of a bite, the typical treatment is 3 weeks of doxycycline. And if you go to an emergency room, an urgent care place, that's what they should do.
Why does Holtorf Medical Group specialize in this? Why do you know how to treat it?
Because it's so often missed. It's so often missed because if you don't have those telltale symptoms initially, you get acute Lyme disease, you felt a little lousy, no big deal, and it goes away. Well, then you can develop these chronic symptoms, headaches, paresthesias, Bell's palsy where your face is paralyzed, numbness, chronic fatigue, depression. It's really a huge constellation of these symptoms, and they mimic so many other things that it's missed, and it's missed, and it's missed. The test that the CDC used for years to say, okay, you have Lyme disease, was never developed to diagnose it. It was developed to track it and to study Lyme disease, but there's now a culture available. So you can, we culture lots of things in medicine. We grow, like if we swab your throat, we're culturing it to see if you really have that streptococcal bacteria. Well, we can now do a culture for Lyme bacteria. Well, that proves that it's still there. It's not that you had an infection a year ago or 2 years ago, whatever.
So is it a controversial diagnosis? Like when you say that, do people go, did I really have that?
Surprisingly, it is controversial. You know, I did my residency 12 years ago, and we really only ever talked about acute Lyme disease. And oh, it's not that big of a deal. If it's treated, great. If it's not treated, they can get this thing called post-Lyme syndrome. But now with this culture, it proves that you still have the bacteria, and the bacteria is still causing these problems of joint pain or tendon pain or headaches or neurologic changes.
I want to ask you, what happens if we don't know we've been bitten by a tick? How are we going to see later on, if we don't get diagnosed? What's some serious things that could happen to us?
I think as long as you don't have serious symptoms, people do have varying degrees of immunity. And so if you have a good immune system, great, it didn't cause you a problem. But if you have some confounding symptoms, whether your doctor says, well, I don't know, maybe it's MS, maybe it's dementia, maybe you just have new onset migraines, this is weird, I can't explain why you're numb in that arm, you really should consider being tested with a culture for Lyme bacteria.
Well, and Holtorf Medical Group can do that. We'll put all their information on our screen and also on our website, located in Utah County there, but go to abc4.com/dailydish and we will link you to their site. And then if you have questions, maybe you know someone going through this, that'll make it easy for you to have the phone number.
Yeah.
Give them a call.
Important.
Thank you.
Thank you, guys.
Thanks for coming on.
Coming up next on the show, we have a great idea for a fun day at Lagoon, plus your daily beauty tip. We'll be right back.